gel is very important because it conducts the ultrasound. We've all had ultrasound done and we've experimented it, and you know the ultrasound is an important medium for the waves to go under the skin. Going to tighten the skin up in direction upwards to improve these nasolabial folds. We have these lines of the action from here to here. This is 25 millimeters, and this is where the line is in the middle. So we're going to start. This blue line is going to show some activity. This part going up. Now I'm going to crisscross. So I'm going that way. So the idea is to deliver the ultrasound waves deep into the tissue at the level of 3 millimeters. This is just dermal subdermal layer, and this will make the collagen fibers contract, and when they contract they pull the skin up, and it helps in having a skin tightening effect. So we did this part for the nasolabial area, and normally the effect will take about 3 weeks for it to show, because the muscles and the collagen fibers will start to shrink by that time. Now I'm going to do the neck part here. The areas that are thick are good to treat with in a painless way. The most painful areas are where there is bone under the skin, like the jawline here. If we want to correct the jowl lines, these are the areas that are difficult to manage. So I'm going to go downwards first, and then I'm going to go vertically upwards. Ideally, we should combine this with a surface treatment, because you see the ultrasound treats the collagen under the skin, under the surface. And to have a good outcome, we also need to treat the surface with either laser resurfacing or chemical peel, and maintenance of skin youthfulness with regular facial treatments. So now we're going to raise her eyebrow. To do this, we will also put the cream above the eyebrow here. Most of the time we need to raise the outer part of the eyebrow. The outer half, or outer 1/3. So this is what I will do. We'll manage this part first. Because the skin thickness here is less than the cheek and the neck, it may slightly sting. Because this is ultrasound waves, it doesn't harm the eyes, so we don't have to cover the eyes. So now what we're going to do is, I'm going to do some feathering around the forehead with a depth of 1.5 millimeter, because the skin is not very thick here. Okay, we did this half of the face, and this half is still going to be done. So the immediate effect now, what we see is some redness here, 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 here. So, but in addition, if we look from the top down, look at her eyebrow, this side and this side. You see, they're not even. This side is up, this side is still the way it is. Look at it. See? Now you can see the difference. See? This is arched. This is flat. Okay? And then look at this fold. And look at this fold. This fold is deep. This is not as deep as this side. Look at this jowl line here. It has improved compared to this one. You see, this is full, and then there is a depression, and then the chin. This is more uniform. The neck part is going to be shown, but the neck, we have to do both sides to see the effect. If you do only one half, you won't see the full effect. So, in summary, left face different from the right, arched eyebrow, smoother nasolabial fold, less distinguished, less visible jowl lines, and the neck will be shown immediately after. The only side effects we see is redness.